Oh, well, thanks for having me back, everybody. You all know by now I'm Helen, psychologist in the Children's Hospital and working on the Medical Needs in Schools project. And today I'm going to talk about managing COVID-19 anxiety in children. As you know, anxiety management is a massive topic. So I've decided today to just focus it on specific management of worries around COVID-19 and your role as educators within OHS. And we might want to broaden that out in a future session about perhaps back to school anxiety. But today I'm not going to talk a huge amount about that. So what we're going to do is to recap just the general principles of anxiety, to think about some of the extra challenges that COVID-19 presents for us, and to think about what we can do to help manage and contain anxiety relating to COVID-19 in the parents and children that we'll be coming into contact with. So just to think about some of the general principles of anxiety that underpin any anxiety management work that we do, or that we want to support in families that we come into contact with. I guess one of the main things to stress is that anxiety is a normal and usually helpful emotion. So everybody experiences anxiety, and actually anxiety helps us. So, for example, in relation to COVID-19, if we weren't at least a little bit anxious, then we might be less motivated to wash our hands, to go outside, without adhering to the rules. So actually a little bit of anxiety is super helpful in life and during the pandemic as well. But when it becomes a problem is when the anxiety is disproportionate to the situation and gets in the way of the things that we want to do or have to do. And I guess one of the issues for me as a psychologist, for you working in education, and at the moment during the pandemic for society, is who decides when something is disproportionate. So what might be disproportionate or irrational to one person is entirely rational and understandable to another person. And I think that is one of the challenges we face when it comes to managing anxiety in the young people we work with and their families during the pandemic. I'm not sure I have an answer to that dilemma, by the way, other than to say probably the second bit, the getting in the way of the things that we want to do or have to do, is probably the most critical part. So let's think about general principles of anxiety and what we can learn from that to apply to managing young people's anxiety. So just a recap of probably one of the sessions I did for OHS a little while ago. What we know about anxiety is that our amygdala is the part of the brain that gets activated when we perceive a stressor. So a stressor can be anything, really. It doesn't have to be something in the real world. It can be something that we're thinking about in our minds. So we know that whether or not something is actually happening to us, or whether it's a thought that hasn't yet happened or might not happen, our amygdala reacts in exactly the same way. And we know that because of MRI studies where people have been asked to think about things and that part of their brain has lit up. So actually, when we think about the implication of that in the pandemic, we know that just the thought about what happens if I go outside, what happens if I have to go back to school, will be enough to trigger the amygdala off. And actually, that level of stress, and we talked about that in relation to staff last week, is probably much more chronic and an increase in our general baseline, much more than in normal life, if there is such a thing. And what the amygdala does when it senses a threat or a stressor is that it sets the chain reaction off in our body. So what we know and call the fight, flight or freeze response, whereby things like adrenaline are released into our body, causing our body to react. So our heart rate quickens, our blood pumps faster, and our muscles get ready to go. But one of the problems when this happens in a more chronic way is that it's not so noticeable to us, and we might not even be aware that it's happening. Certainly the young people that we work with are unlikely to recognise these things as anxiety. The other impact of this is that the thinking part of our brain, so the cortex, becomes less effective because the body has evolved to act first and think later in stressful situations. So we need to be able to sort of run away from that lion before we think about whether it was a friendly lion or a wild lion. So we can think about that later when we're safe, and that's the way our brain tends to react to these
Friendly
things.
lion.
Somebody said a friendly lion there. Could be Simba, you never know. So in terms of then the impact of this on our brain, there is a feedback loop. So our brain will then start to think, oh, what's going on? The body feels a little bit weird. It feels uncomfortable. Something must be wrong. And this can cause more worry. So we might start to focus on what those sensations are. So children will go to their parents and say, oh, don't feel very well, I've got a tummy ache, or they might recognize it as anxiety. And in turn, that will increase the parents' concern and focus. So they might ask their child more, are you okay? How do you feel now? That will increase the focus on the symptoms and so on. What we know is as we worry more, the amygdala will keep reacting and keep releasing that adrenaline, and so a feedback loop continues. And sometimes the bodily sensations in themselves become the thing that stops us doing what we want to do. So if a child has tummy pain, in the current climate, perhaps they'll be less likely to go out and get some exercise because they're worried about that tummy pain. And sometimes it's the thoughts that get in our way of doing what we want to do. So sometimes those thoughts can spiral and they can become more and more worrying. So in the pandemic, that might look like, well, I can't go outside at all because who knows, there might be somebody that walked past and touched my gate, for example. So whilst those are, they're not impossible things that might have happened, probably the likelihood of some of those thoughts are quite low, but that can get over amplified in children who are anxious, indeed in adults who are anxious also. So what do we know so far about anxiety during the pandemic? I think what we're learning is that reactions are hugely varied. So many children with pre-existing anxiety are actually doing quite well. They're perceiving the positives, and a lot of the triggers to their anxiety are reduced because effectively the pandemic is allowing a lot of avoidance of triggers. So, for example, something to do with school or going out, crowded spaces. But we know that that's situational, and we are anticipating that as going back to school becomes a reality, these issues are going to come back with a vengeance for many young people. But actually, at the moment, lots of children are coping pretty well at home. I suppose one of the biggest things that children and young people are struggling with is and I'll come on to say a little bit more about this, the COVID-related impacts, such as lack of routine, lack of sort of normality, not seeing friends, and so on. And of course, as I'm sure we'll all be acutely aware, that in England there is some discussion about schools going back in June, and so that is going to be talked about in front of young people and may raise anxiety levels. But we know that anxiety is influenced by lots of different things. I'll come on to talk about that briefly. And one of the complicating factors in the COVID pandemic is, of course, a lot of the information is complex. And as somebody I watch the daily briefing every day, I do a lot of reading, and frankly, I don't understand it. So how on earth are we expecting children to grasp the complex information and make sense of it in a way that helps them to feel secure and settled, when as adults, it can be a real struggle for us? So we know that anxiety, this is something that you'll have seen before in a previous talk, anxiety will be impacted on by all of the same things that impact on a child's understanding of illness and death. And I've put this up as a reminder, really, that no matter sort of how well we try and contain the information that a child has, or our anxiety management strategies, all of these different things are going to come into play. And as professionals, some of these we'll only have a incredibly limited or no control over. So this will probably be pretty familiar to you. Anxiety can show itself in lots of ways. So again, I was thinking about if parents ask you questions when you're speaking to them remotely about is this normal, some of the things we would expect to see include a regression in behaviours, increase in clinginess. Actually, a lot of my friends are saying that their child coped quite well initially, and now they're starting to become perhaps a bit more clingy as time has gone on. Multiple and repeated questions, disruption to sleep, maybe increase in dreams and nightmares, somatic symptoms, which can be symptoms of anxiety, so tummy aches, headaches, and so on. Especially in older children, racing thoughts, expressed worries, thinking about the what ifs. And then two kind of almost conflicting presentations. So being more withdrawn, spending more time on their own, appearing sad, and then almost conversely, anger and aggression. And if we think about that fight, flight, or freeze response, that adrenaline production is often right there at the surface for our young people at times of stress. And of course, with limited exercise, it might be a lot more difficult to use up some of that energy. So we might see that anger and aggression getting closer to the surface and difficult to manage as that cortex is less able to rationalize some of the worries that a child has. So I wanted to briefly list some of the things that our young people are anxious about right now in terms of COVID-19. You will have a much longer list, I'm sure, of the families you've come into contact with. But there's factors to do with the virus itself, so catching it or family members catching it. And then there's more specific impacts on the child's life. So change in routine, not seeing friends, worrying about what they're missing out on in school, exams, starting to worry about getting back to normal and going back to school. And of course, unfortunately, we know that some young people are experiencing adverse home experiences such as abuse and neglect, and there will be a much greater likelihood of that being unescapable for them, whereas school might have provided some relief and space from that. So lots of things triggering children's amygdala. And I guess I wanted us to just reflect on what is your role in supporting a child and their family in managing their anxiety during the pandemic. Do you have a direct role? Would you be giving advice or tips? Are you likely to be having conversations with parents who might ask your advice on what they can do to support their child? And what isn't your role? It's unlikely that you'll be doing direct anxiety management work with a child, but just in the interactions we have with a child and their family, there might be opportunities for you to support the process of anxiety management. So certainly you will all have a role in helping to contain that child and family's anxiety about the pandemic. And as we said in the talking to children about illness, possibly thinking about how do you promote attachment and adjustment in terms of the child getting the information that they need to feel more settled. So I wanted to share with you some thoughts on some top tips for supporting both children and parents with worries about the pandemic. And I think taking it back to what are the hierarchy of needs that we all have, but particularly children, and right down there at the bottom of the hierarchy, so the building blocks for any of us to feel safe and secure, we have to have our basic needs met. So thinking about food, sleep, how do we get a sense of safety and security? And just at a very basic level, encouraging the families therefore to stick to a routine as much as possible. So whether that's bedtime, it doesn't necessarily need to be the same bedtime as in non-COVID times, but a regular bedtime, a regular getting up time, regular meal times, and as much routine as possible. Thinking about exposure to information. So we know that children will create their story about what's going on from what they hear from the important people in their lives. So if there's conversations going on in front of the kids that are sort of, oh gosh, this is awful, isn't it? My child's not going back to school, and you know, this is crazy, this is not safe. That might well be that might be the reality, that might be a perception, I don't know, but the child will be listening to that, and that will shape how safe and secure they feel about a situation. So just thinking about how much of those adult conversations are going on in front of the child. Encouraging the child to write down any questions and to support them to source the answers. So indeed, if a parent raises questions with you, or if a child does, thinking about writing them down and who's the best person to get that information from. And we know that it's not always possible at the moment to offer reassurance, because a lot of the risks that we're talking about are real risks. They're not perceived, and they are out there. So reassurance that people are doing all they can to help, and reassurance that everybody is trying their best to help manage coronavirus might be a better option than reassurance that you're not going to catch it, for example. And thinking about how do we control that amygdala and keep it under wraps. So exercise inside the house where possible, and obviously now we can do a bit more outside. And thinking about relaxation skills such as breathing and such as progressive muscle relaxation, which I can send some resources around to send on to families if you'd like to. In terms of parents, many of your conversations will be around containing their anxiety about the pandemic. And what we know is that if parents' anxiety is better contained, then that has an impact on containing the child's anxiety. And we have to acknowledge that as professionals and first and foremost as people, we have our own anxieties, we have our own worries about risk. And thinking carefully about how we manage that when having a conversation to parents who might well share the same concerns and anxieties as we do, and how we balance those conversations with containing that parent's anxiety whilst they might well be mirroring our own concerns. So thinking about how we can be honest, but also containing, because we all interpret conversations and we all sort of repeat what we've heard, especially in a pandemic situation where there's a lot of shared information, there's a lot of discussion of sources and who said what. So bearing in mind that what you say will be interpreted and possibly repeated. So I put an example here kind of to illustrate some of these points. So it might be tempting when a parent is talking about their anxieties to say something like, yes, gosh, yeah, we are all really worried about that as well. Our children are going to be safe. And actually contrasting that with something that's a bit more neutral and a more containing way of approaching that. So yes, that's definitely on everyone's agenda to think very carefully about that. It's a top priority for us too. So thinking about the difference in those two ways of handling the same kind of question. The first one is sharing a worry and sharing a legitimate worry, but it's also perhaps being less containing to that parent that, gosh, yes, it's not just me that's worried, even the teachers are worried about this too. And whilst that is likely to be true, I would probably say, it's probably not a containing statement. Whereas sharing the worry, but also saying, yeah, we're thinking about that, everybody's sharing that importance. And that's going to be carefully thought about, helps to contain, but also a sense of shared worry. So just thinking about how the conversations that you have with parents can help contain them and therefore impact on a positive experience for their children. And I think that is pretty much all I wanted to say. Like I say, it's a very quick whip through and definitely focusing a bit more on managing COVID anxiety rather than back to school anxiety. And I will stop sharing my screen now and we can think about any questions.